Have you thought of getting mental health services but just don't know where to begin? So we have taken the initiative to personally look through all of that information online, call up various organizations, and even consult with our professional peers to prepare this comprehensive guide for you.
24 Local.
Beginning with option 1, government or semi-government hospitals. Going for mental health care services provided by the government is a great way of receiving psychiatric consultations and medication for a very affordable price. In order to start receiving services, the first thing that you need is a referral letter. You can receive one by heading to your nearest GP clinic and to request for a psychiatric referral to a government hospital of your choice. A GP clinic is the one that you go to whenever you're having the flu, usually available in any commercial areas. Otherwise, going to a government clinic or clinic kesihatan to get a referral letter is also possible. Now, when we called the Hospital Kajang and UMMC, both hospitals were also accepting referral letters written by a psychologist. So, if you're currently undergoing therapy by a psychologist and would like to receive affordable medication as well, you may just request for him or her to write one for you. Now, depending on the capacity of the hospital, your appointment will either be set on the same day or a few weeks later. Number 2, Mentari. Mentari is a new initiative by the Ministry of Health to improve mental health outreach. There are Mentari branches in different states across Malaysia. Now, making an appointment at Mentari is a little bit different. You'd have to call and get the email address of the Mentari branch that you'd like to visit. Then, you are required to also complete the DAS21 questionnaire online, screen capture the results, and email it to them requesting for an appointment. The Mentari branch that we contacted advised that getting an appointment may take up to a month due to the amount of appointments that they have to fulfill. The advantage to receiving government services is the low cost, and I think this is the biggest advantage to healthcare in Malaysia. However, the disadvantages are, number 1, the uncertain or long waiting time. Due to overwhelming demand, it may take you a while before you're able to get an appointment. This would mean that you may be unwillingly delaying your treatment despite needing it. The second disadvantage is that it may be inconvenient to get a referral letter or to complete certain steps before you get a chance of having an appointment. Disadvantage number 3 is that there may be limited counselling or psychological services available. Not all government mental health facilities have psychologists or counsellors. And even if they do, it will depend on a case-by-case basis or a long waiting time until you get an appointment. So all in all, government mental health services are a great choice if you'd like to undergo pharmacotherapy at a very, very affordable rate. Option 3, NGOs and associations. There are organizations which aim to provide counseling services to the public for free or at a low cost. Different organizations may have different steps, fees, and waiting duration for you to receive their service. At the same time, different organizations also offer services by volunteers with different levels of training and experience. Now, the advantage to getting sessions from NGO or associations are, number 1, the low cost compared to private centers. Most associations charge below market rate, are free, or by donation basis. As such, this may be an attractive alternative for those seeking counseling services but are unable to receive professional service due to cost limitations. The person helping you is also a volunteer. Despite the limitations of less training and qualifications, this person may have the best interest for you at heart. On the other hand, the disadvantage is that most associations may not have fully qualified professionals who are able to provide evidence-based treatment for your mental health issues. So, if you are experiencing a very difficult time with your mental health and would like to be sure that you are receiving the level of care that is required, it may be best instead to reach out to someone with more extensive training and the right qualifications. Option 4, psychological services by universities. There are currently a variety of universities which offers postgraduate studies in counseling or clinical psychology. As such services would also be provided on campus grounds. The advantages of getting services from a university are, number 1, again, the low cost. This is because most services are being offered by their students currently undergoing training. Another advantage is that if you require a comprehensive assessment of your mental health, such as through IQ and personality testing, then these universities should be well equipped with the tools required to do so at a trainee rate. The disadvantage to receiving services from university trainees is that they are still undergoing training to be fully qualified. They will be in their internal placements. This will mean that they are at their earlier stages of providing counseling or psychological services. Despite this, they should be receiving supervision by qualified practitioners, so you know that your sessions are being monitored by someone who is more experienced. Last but not least, option number 5, private services. So far, we have examined the advantages and disadvantages to other options. Among the disadvantages are long waiting time, service providers with different levels of training, or the inconvenience of going through multiple steps before receiving your service. All of these disadvantages do not exist with receiving services from private centers. With just a Google search, you are able to find a whole list of qualified and experienced practitioners, whether they are counselors, psychiatrists, or psychologists. You are able to choose someone with the qualifications and background that you are comfortable in working with, the location of the office, and even the time and day that you like to have the appointment. Generally, scheduling an appointment is painless. All you have to do is to give them a call or maybe submit an inquiry form, and there shouldn't be a long waiting time before you're able to receive an appointment. But all of this convenience and accessibility in meeting a qualified practitioner comes at a cost. Although there's a wide range in costs, qualified therapies are widely available within the range of 2 to 300 ringgit. Red flags to be aware of when seeking private services are: number 1, if a practitioner does not openly provide his or her background and qualifications. If the person is being vague or makes it hard for you to get it, then it's best for you to avoid. Number 2, if the practitioner seems to have an unrealistically long list of qualifications or accomplishments, you may want to check if these qualifications are real or not. Number 3, if the practitioner intends to sell you quote-unquote alternative medicines or supplements to treat your mental health issues. Please take note that only psychiatrists are able to prescribe medication in treating mental health issues. Qualified therapists such as counselors and psychologists do not sell you supplements of any sort, and if you are being offered such things, it's best to no longer seek services from that person.